Ladies and gentlemen, it's approximately 2 o'clock and you're all very welcome to the Health and Wellbeing Board of the 17th of April. It's a hybrid board today, so between 2 and 3 we'll be going through the standard agenda, and then at 3 o'clock we shall be going through for coffee, biscuits to the assembly room, and also there's going to be a talk on the building blocks. Sorry there. Okay, thanks Penny. So we're going to go through and have a talk about the building blocks of health. What makes us all healthy? What makes our communities healthy? You started early today, Councillor Wilmot. And then that should be between 3 o'clock and 4 o'clock. So it should be very interesting indeed. So I'm going to start off with the minutes of the last meeting. The minutes of the last meeting, as always, are for noting unless there's a typographical error or such that you've noticed. And I'm going to go through the pages: page 1, page 2, page 3, page 4, page 5, page 6, and page 7. So, all those in favour that there are an accurate record of the meeting? Yes, James, let me pass those over to you. Fantastic. So we've got declarations, James, of absence. Have we any absences today?
Okay, so we've received quite a few apologies today, Chair, so I'll just list them out now, as well as some substitutions. So we've got apologies from Councillor Sinead Anderson, who is being subbed by Councillor Scott Carlton. We have apologies from Dave Briggs, who is being substituted by Janine Elson. We have apologies from Fiona Callahan, Sarah Collis, Lee Edel, apologies from Vivian Robbins, who is substituted by Catherine Pritchard. Apologies from Councillor Henry Wheeler, and apologies from Melanie Williams, who is being subbed by Katie Ball. Thank you, Chair.
Fantastic. Thank you very much, James. And declarations of interests. If anybody has a declarable pecuniary or non-pecuniary interest in any item on the agenda today, just put your hand up. If at any stage throughout the afternoon you realise that you might have a pecuniary or non-pecuniary interest, then just let the chair know. Thank you. No declarations. Fantastic. So we'll move swiftly on to the chair's report. This is probably a reasonable time to look at smoking and vaping 13 through to 15 and our efforts to become a smoke-free generation, and that we've been allocated an extra £1 million to actually improve the services here in Nottinghamshire, improve the existing services through the use of that £1 million, increase the resources that we have available, particularly targeting those with severe multiple disadvantages, the homeless, those with mental health problems, and that £1 million will go some significant way to getting Nottinghamshire to a smoke-free generation, i.e. a generation that less than 5% of the population smoke. Of course, in places like Rushcliffe, 5.9% of the population smoke, and indeed part of Nottinghamshire in that instance are almost already smoke-free. So when people say it seems like an impossible task, it's anything but an impossible task. We were, of course, helped by the bill going through Parliament yesterday, where they were actually going to approve the legislation to stop anybody buying cigarettes who would be 18 on the 1st of April 2027 and incrementally increase the ban by a year every year, such that people who are 14 today will never legitimately be able to buy a cigarette in their lifetime. And once again, I have to reiterate that with something that kills 1 in every 2 people that uses it, the biggest killer of cancer, the biggest causes of morbidity, mortality, the shortening of life, the shortening of healthy life expectancy, and the cause of 50% of the difference between Rushcliffe life expectancy and Mansfield and Ashfield. 7 years difference. If you stopped everybody smoking in the morning, it would go to 3.5 years. A 50% is the most incredible thing that's possible. If you all lived to be 100 and you all did the greatest things you could ever do in the whole of your life, you'll never match the sheer health benefits to the community, to the country, of Rishi Sunak putting through the bill to ban smoking for today's new generation. It is absolutely phenomenal, and I think it's a real stamp on the preventative agenda that we in the Health and Wellbeing Board are trying to drive through at each and every meeting. It actually puts it front and foremost that prevention is the way forward. So I was absolutely delighted to see that go through yesterday. I'm hoping that fluoridation will follow. You may have seen that yesterday Leicestershire became the latest county to actually request the government to allow it to fluoridate its water, and it looks like the dam is bursting and everybody's flooding through with their requests for fluoridation of water. And who knows next? We could be following the Scottish with a reduction or an increase in the minimum unit price for alcohol. So it seems if the Secretary of State for Health is driven by the preventative agenda, I think it bodes exceptionally well for us in health and wellbeing going forward. In terms of the Chair's report, I'm going to come back to measles and the fact that obviously we've had a number of cases in the East Midlands or the Midlands, Birmingham, the odd death and cases moving towards Nottingham. There's no outbreak as such, there's no cluster of cases to declare as such, but it always gives us that opportunity to look and focus on the things that we do well and the things that we need to do better. It was only in 2017 that we were able to declare ourselves measles free. We had a measles free country, and it was relatively maintained over COVID, etc. But the rates of vaccination over that period of time fell. In order for us to remain with herd immunity, we have to look at things like 95% of the population being immunised. That is 2 doses at 1 year and 3.5 years, and that sort of slipped through a variety of reasons. Vaccine hesitancy, etc., culminated in COVID and fall off in a lot of areas, and we're particularly poor as a world, never mind a country, in eradicating diseases. The last disease that was eradicated was smallpox in 1977. The least we can do is actually try and attenuate cases of disease and make ourselves disease free, but there's very little that we can actually eradicate. So at each and every opportunity we ought to say to people, get yourself vaccinated, get your children vaccinated, get the herd immunity up, get us up to 95% and keep us as safe as possible. Not for the kid that chooses not to be vaccinated, but for the one that has chosen, Councillor Wilmot, to be vaccinated, but doesn't seroconvert, or who is on immunosuppressants, or is vulnerable for other reasons, and they become a victim of somebody else's vaccine hesitancy. So measles hasn't arrived in any significant form yet, but we keep vigilant in that respect. So moving forward, hypertension is one of the big things. Nottingham is really putting itself on the map with hypertensive case finding. Going out to find people with blood pressures which are high, which left unchecked will give stroke and heart attacks, and a lot of people turn up in hospital and they're diagnosed that they've had a stroke or a heart attack, and then they're told the blood pressure was high. How much better it is to know your blood pressure is high, to intervene, and we are doing that on a county-wide basis, particularly in Mid-Notts, Dylan. Are you aware of the activities?
So thank you, Chair. So what we are doing is, so hypertension is one of those, raised blood pressure is one of those medical conditions where, as an individual, you might not have any symptoms, probably a slight headache, maybe feeling a bit off, but in general, it's undetected, but it's one of those which we would say as a silent killer. And if you have a stroke, depending on the type of stroke, the cost to an individual and the NHS can be anything from 24,000 to 48,000 a year. And also, if you have a stroke, what we know is you can get paralyzed for life, which will have significant implications for that individual, for their family and their carers, and also an economic impact as well. So it's right for us to go out there, identify the at-risk population, and screen a blood pressure check, whether through a service, which is in Nottinghamshire, in Mid-North, we've gone through using a healthcare organization called PICS, but we're also looking at how pharmacies can do that as well. So community pharmacies can check blood pressure in patients, because early intervention, when we identify lifestyle modifications sometimes, because not only hypertension, when we do other tests, we can look at cholesterol levels, blood sugar levels, and even address things like obesity, overweight as well. So it's one of those real primary prevention things which we can make a big difference for our local population. So in Mid-North, what we are doing is we are particularly targeting the high-risk individuals, and then through GP surgeries, we are managing those patients in time, and then they get their annual checkups, so on and so forth. And hopefully we'll have that across the whole of the county as well.
Fantastic, Tillum. Again, there's huge amounts of work to go occur across the county, and it's just very nice to be able to update people on exactly what those are. So I'm going to open the chair's report for anybody that wishes to make any comment before I recommend its contents. Councillor Wilmot. So you go ahead and take that call. No. It could be, yes.
Right, Jim. Yeah, sorry about that. As far as measles is concerned, what can concern me a few weeks ago, I saw on social media that certain people were putting that you don't need to be inoculated against anything these days. It's just not done. And I just want to say that we should do a campaign or something in that respect to allay any fears about inoculations.
It's funny that you would say, let's do a campaign. Wherever I look, there is actually campaigns going on everywhere. And at each and every opportunity, people are out there promoting vaccinations. And sometimes you don't see what's going on, but there is a huge amount of campaigning. Catherine, would you like to just update on that?
Yes, thank you for that. And you're quite right. There are numerous individuals that try and dissuade people from vaccination. But apart from clean water and cleaning up our sewage supplies, vaccination is the third most important thing that we can do to protect an individual's health. So the campaigns going on at the moment are particularly targeting children and babies. So that's where the focus of the work is at the moment, and colleagues are working with nursery facilities and with colleagues in the NHS in trying to promote that. So I'd like to sort of reassure you that that work is actively going on at the moment. Thank you.
The reason I say that because I was speaking in a couple of nurseries in Oxford and a couple of primary schools, and I didn't see any notices of them that you see. The churches and libraries, but then they are absolutely essential, because that's where people go. So we want to try and get, make sure that people are aware of that situation, that how essential it is to get inoculated.
Absolutely.
And even with grown-ups as well.
Again, anybody can have a booster. If you think you haven't had it, just go along and to your GP, and you'll be able to get yourself a booster. Yeah, okay. Thank you. Dr. Elson.
Thank you. Yes, indeed, we've got a very big social media campaign running. We have had catch-up clinics available for those children that haven't had their vaccinations running across the county. we are offering to all school-aged children, whatever immunisation they're having in the school-age immunisation programme, the opportunity to have their measles vaccinations as well. So we're positively promoting that wherever we can. And we've also running that social media campaign, some of the things trying to dispel the myths that are around measles and present that information out, as well as having several articles in newspapers and also being on local radio.
If I could just come in, I've got the update on the England measles.
Yes.
And it just says that cases are going up again.
Yes, epidemiology. So normally, if annually you would have 100 or 150 cases, Birmingham had that in 1 month.
Yeah.
So, and that's what you're looking for from an epidemiological view, as to not just a case or a sporadic case. You can actually be measles free with a sporadic case. It's actually clusters of cases, your ability to detect those cases should they exist, and an effective vaccine campaign, vaccine system, which is actually the things that contribute to you being considered to be measles free, as opposed to never actually having a case of measles. I'm going to go over to Penny Gowland.
Thank you. The report describes a large number of really great initiatives aimed at improving health in a broader sense across the whole of the county. I just wondered what's done to evaluate these initiatives. I was just looking at the two, 28 to 31, where there are two aimed at keeping people warm in the winter. You know, if you had money to spend, will we know at the end of this year which is the best way to spend it? One's about keeping people warm in their home, one's about warm spaces. One might speculate about, you know, different people needing different sorts of intervention, but as a general question, is there an aim to evaluate these, you know, excellent initiatives? Thank you.
Catherine.
I'm not sure about those projects themselves, but certainly we have an ongoing process of evaluating the work that we do within the County Council and within public health. So as part and parcel of commissioning the work, of commissioning a piece of work, we do look at embedding evaluation into that. I'm not familiar with those particular ones that you've mentioned, but certainly that's part of the routine of what we do.
Yes, of course, Penny.
Thank you. Is there somewhere in the council, maybe not here, that we get feedback from that, because it's really useful information generally?
Yes, certainly. So if I can give you an example, share with you an example. So at the moment we're evaluating our integrated wellbeing service, Your Health Knots, and when I bring a paper next time, we'll be looking at bringing that evaluation, I think, to the October board to share that. So probably those big scale ones, we would try and weave those into either the chair's report to help support you.
Thank you, Catherine. Councillor Carson.
Thank you, Chairman. Just quickly to come back to measles and a point raised by Councillor Wilmot, who raises a very valid point. Just from an executive point of view, with my responsibilities around public health within this authority, I'm being kept regularly briefed on the situation across the county, but also have an open dialogue with city colleagues as well. The other thing, just to add to sort of the campaign, if you like, I've recently asked if all members within the authority, particularly those that are in identified areas where vaccination rates are low, so just to explore what the role of elected members can do. As we know our own patches very well inside out, particularly those hard to reach communities where we know vaccination rates in particular areas of the county, particularly Mansfield and Ashfield, where they are a little bit too low. So more information to follow.
Thank you, Councillor. Councillor Schuler.
Yeah, that mine follows on from that actually. I was wondering what local data we have about primary childhood vaccines and the uptake, and where there are delays in scheduling, because I do know that in Bassetlaw we do have some delays in providing vaccines to children in line with the JCVI schedule.
Councillor Carson.
Yeah, thank you. And I'm grateful to Councillor Schuler for highlighting that particular issue. I don't necessarily have the data in front of me right now. However, with your permission, Chair, if we could have an offline conversation after the board, I think it would be useful to highlight that. Thank you.
And of course, the challenge is the disparate communities, those communities who believe that the MMR is associated with autism, which has been discredited from the Andrew Wakeman paper, the travelling communities, particularly the immigrant communities from certain countries in Europe who like to have the measles, mumps and rubellas separately administered, etc.
I'm actually referring to
Yes.
young families with young children who are awaiting their call for a vaccine
Yes.
that aren't receiving it in a timely manner. Yeah,
yes.
thank
So
you.
if you're 1 year of age and you would normally get it at 1, you mean that there's a slight, yes. So that is, yeah, but that's just a routine vaccination recall that's existed since time immemorial. Well, 1988, as it happens, with the introduction of the MMR. Dylan.
Thank you, Chair. I think what we could also look into, Councillor Schiller, is that as from a GP, if I put my GP hat on, so it's a routine recall with this starting from 2 months, 4 months, 2 months, 3 months, 4 months as the vaccination program starts. So if there are areas which have been identified, we probably need to look into understand the reasons for such delayed invitations. Is it a process issue? Is it something where individuals are not identified as such? And also from an ICB and a place-based partnership, so most place-based partnerships have programs of along the lines of Best Start, where vaccinations is one of the key areas to look into. So maybe it's something from a future agenda, from an ICB perspective as well, we can look into finding that. What I can say is from a data point of view is that, again, through eHealthScope or GPRCC from an ICB, we have rich sort of data source to identify where the gaps are, and some of the targeted interventions through place-based partnerships is to identify those pockets. I do acknowledge the fact that there is the vaccine hesitancy and the vaccine resistance, so there's a bit of a social media knowledge of improvement exercise that needs to go through. But as the chair said, some of the myths around MMR did help, which has now been discredited, so there's a bit of a catch-up process overall as well. Thank you.
Yeah. And there's a porcine-free, pig-free MMR vaccine available now. Okay, I'm going to take one last comment. Councillor Wilmot.
Thank you very much. Just about the two health issues that you in your report about encouraging weight loss. Now I go to a number of classes and talk to people that are actually trying to lose weight, and many of them are saying that it's all right. Thank Health Nuts for inviting them to these these weekly exercise, but many people can't do the exercise because of serious health problems, and they can't afford the diet programs that are in the supermarkets and everything. Some of them are £50 and £60. It's absolutely unbelievable. Can we have a look at that situation and make something affordable so that people that can't exercise they can have a go at a diet that's proven, but it's not too much of a cost.
So, well, I suppose diet is a completely separate thing from the exercise side. So, Catherine, what's our weight loss offer from a dietary point of view?
Yeah, so our provider, so Your Health Knots, do provide a weight management and physical activity offer for individuals, and that's free. So certainly sort of directing people in that direction. Yeah.
So I will be getting that message round.
Great. I'd appreciate that.
And the other issue, Chair, is the smoking and vaping. As I go around the schools and so on, see children, many children as young as 11 smoking, and it does seem to me that it's due to underlying problems they've got. So if we sort out the underlying problems, probably they wouldn't look for something to do to distract them from the underlying problem. Mental health issues,
another related stress problems. There's loads of the people that are smoking that are because it's something just to do to try and combat the stress or mental health problems. Yes, once the bill passes and people are banned from smoking, that'll no longer be a problem. So just take your time. You just need a bit of patience, a few years. Hang in there. Right, I'm going to move to recommendations to consider the chair's report and any implications it has. Can I have a seconder to them? All those in favour? Excellent. So we're going to move swiftly forward to one of the most interesting paper refreshments that I've read in quite some time, which is the carers report. The staggering fact is probably something like £196 billion of care given by carers, which is obviously as a saving to the NHS by voluntary care. So in terms of the carers report and everything in it, I'm going to pass over to Anna Oliver.
Thank you. This Carers JSNA is a refresh of our previous one that we had in 2014. And obviously we've been through some significant changes since then with COVID, cost of living crisis. We've also had some updated census data as well that's formed part of this refresh. The other thing that's worth noting that's different this time to last time is that this JSNA is all age, so it's our carers as young as 4 weeks we support in the county, and previous JSNAs were only our adult carer population. So some of our key findings when we're putting this together, there are 5 million unpaid carers nationally. Of those we have about 82,000 in Nottinghamshire, and over 1,000 of those are up to the age of 16. So these are children providing care to siblings or parents or grandparents alongside their education and the impact that that has. The other thing really worth highlighting is that the census data showed that across the whole of England, Nottinghamshire actually has the second and third highest rate of carers, and that's in Ashfield and Mansfield. So it just shows that we've got some significant need here. And of those carrying out caring tasks, people are doing that at a higher rate than they are as an England average. So the England average is just over 8%. Our carers are around about 10% for those that higher impact. And most carers in Nottinghamshire are white according to the census data. Sitting alongside that is also the fact that our census data this time shows we've had a slight decrease in our carer population in Nottinghamshire for about 8,500. We think that's because carers aren't actually acknowledging that they're carers, don't recognise that they're carers. So if you're a neighbour providing shopping services, people may not have acknowledged that on the census as being a carer. We've done lots and lots of work alongside doing our carers JSNA, and we've also previously done our carers strategy, that's an all-age strategy. And carers are telling us what they need, where our gaps are in services. So some of those are things around support for our working age carers. A lot of our services are between 9 to 5 Monday to Friday. So we're looking at expanding our service offer for those working carers. And also parent carers. There's some doubt about where am I a parent, where does that parenting role end, and where do I become a carer, how do I make that differentiation. Carers have also highlighted that short breaks are an issue for them, and being able to access those when they need to in a really flexible way that meets their needs. And they're also facing pressure due to the cost of living crisis. So we could give them a break, for example, but actually what do they do with the break if they're struggling for money already? How do they make the use of that break? Just in terms of who a carer is, going back to that thing about carers being able to identify, the Care Act says that those carers are people who provide any form of support to a friend, relative, neighbour with their day-to-day life. They don't have to live in the same household. The definition for a young carer is slightly different, and again for a parent carer is slightly different. Or all in all, it is that providing support unpaid to another person. In terms of the recommendations from the report, so these are all the things that have come out from talking to carers and all of the data and everything that we've looked at nationally and impacts on people. One of the big things is around respite. So people tell us that they need those breaks. So we have project underway currently looking at how people get access to breaks and also what that offer is at the other end. Assessments for carers, so making sure that carers are part of that whole family assessment. Their needs are looked at alongside those of the person they're caring for, because there's an impact for both people when we look at the assessments. Carers are also saying that they could use tech. How can we use technology to improve carers' wellbeing? How can we put some replacement care in potentially for carers so that people can do things in a different way? So that could be things such as medication reminders, so that you're not needing a carer physically present to hand over your tablets. Carers tell us that they want access to information, advice and guidance. Being able to find what you need when you need it in the way that you need it is really important to carers, as is planning for change when things might change. You've always got that worry in the background. If something happens to me, what happens to the person I'm caring for? And also being able to identify carers. So we can't do any of this work with carers if they don't recognise they're a carer or we don't know about them. So all of this stuff we've brought together in our new commissioning services that we started in October last year. We also have a piece of work underway around our young carers. So as you can see from those slides, we have quite a large number of young carers in Nottinghamshire, and we're working really closely with our schools to identify more of those young carers and provide support to them at the earliest opportunity, so that they can have that education experience that their peers have, be able to go out with their friends and do all the things that their friends do. We're also developing our offer for parent carers so that they can get the same sort of support as our carers caring for adults, but also really make that distinction about what is parenting, but what sits outside of that. And we're looking further at our inclusion, so we haven't seen a huge amount of people from ethnic minority backgrounds, for example, or people who may not have English as a first language, including sign language, come through our services. So we're actively reaching out to groups of people, and we're trying to grow our co-production as well in that remit, so that lots of other people can tell us what works for them, and we can grow our service offer. As I mentioned before, we do have our all-age carer strategy that we launched last year, so many of the recommendations that have fallen out of the JSNA we also recognise as part of our carer strategy. That's a joint strategy with our City and ICB colleagues as well. So we're picking up lots of this work as part of that strategy implementation across the board. So our ask of today is obviously that the Carers JSNA chapter be approved so that we can use that and start working on those recommendations alongside our strategy, but also that we each consider as organisations our role within this, so how we can reach out to carers, get more carer identification, how we can change what we do to support carers better, so something like, accessible appointments or making flexible hours for people that's outside of the 9 to 5 and supports people around their caring role. Thank you.
Fantastic. It's just one of those unseen phenomenal contributions to the well-being of society, as we started off with something like 193 billion. I think the paper was beautiful in its simplicity when it said, what do the carers need that they haven't got, and what is it that distinguishes one set of carers from the other? Largely it's economy, what they can afford, and the 48% of them said they've gone out and bought their own equipment, that they've paid for mobility vehicles, that they've paid for day centres, etc., using their own monies, etc. So it's easy to identify the things that create health inequality in between the carers, and I think that was very nicely highlighted. The recommendations are equally clear, recommendations 1 to 12, highlighting the exact things that you said there, making it easy, providing the knowledge, having a single point of access, etc. And I think the recommendations are very clear, etc. So with that in mind, I'm just going to open it up and throw it out there and see if anybody's got anything to contribute. Councillor Wilmot.
Yes, I've researched all this over the last week, and I do go regularly to the Carers Association meetings and the local one as well, because only by meeting these people do you find out exactly what the problems are. And as I say, carers in Britain is the most incredible, important people you could ever meet, because once you've started doing caring, your whole attitude to life changes, and you accept a lot of things that other people wouldn't accept. In Nottinghamshire, in whatever, when I looked it up, it said that there's almost 42,000 carers. Some are providing 50 hours a week caring. 50 hours a week, it's not an easy job either. And it's a large increase over the past few years. They seem to be having to do more work than they've ever done. And help is required urgently. And the first thing about the breaks, I think that is absolutely essential. If you're caring day after day, night after night, you do need a break. And I think that's one essential thing that has to be sorted. And they shouldn't have to bow and scrape for things either. I mean, when an assessment's doing, it's far better to get an assessment up face to face rather than having reams of newspapers sent to you that you don't understand. It's and that happens. They're telling me this at the meetings and so forth. And I mean, we must really support our young carers to make sure that they're getting the educational opportunities because sometimes they miss out because of all the work they're doing with the families. That it's happening all the time. I'm a little bit concerned about that, and employment opportunities as well. I mean, if you most of them don't think they can get a job because 2 hours here available, 3 hours there, and so forth. But there are jobs that you can get, even in supermarkets. That they're prepared to look at how carefully at your problems and try and help you with a few hours. Because money is very tight, as we know, and it's a great opportunity for them to get something. Finally. There are a number of carers with got severe multiple disadvantaged people. That needs to be looked very, very closely because that's a very, very difficult job, and it's a specialist job, and you need specialist people to provide help. So it's we are doing a lot. I realise that, but we've got to fully support. The issues that there are there, and I support all the 12 initiatives that you put forward, but don't try and do too much too quickly because I've always been one of these people that makes a dozen priorities when really I should be doing 3 and get them sorted and then move on to the next one. So as I say, good work being done, but a lot to do.
Thank you, Councillor Wilmot. An ever-aging population with, as you said, increasing multi-morbidities, which are only going to require increased care as we go forward, and looking after those unpaid carers, absolutely critical to identify and support. Helen Smith.
Thank you, Chair. Just a couple of things to raise. I think, firstly, how positively received the October commissioned services have been, particularly being ICB, county and citywide. I think that's been fantastic. So just wanted to acknowledge that. I also agree with all the recommendations, absolutely. I think the thing that would be really important from a health point of view to ensure the carers are identified, that's written within contracts and commissioned services, because there's very much a focus on the person that you're treating, not the care and support explicitly written. And I do recall probably 5-10 years ago, we're not commissioned to support the carer. Awful phrase when you're looking after a person as a whole. So I think it would be really helpful as an action to review commissioned services and ensure that carers are explicitly mentioned within there. And I think just again to acknowledge the great work that our adult social care colleagues are doing around their strengths-based approaches, in that get picked up in a really constructive way on initial assessment. So thank you.
And also interesting the fact that some carers are actually looking after more than one person, the complexities in that. In the day-to-day work, we have a carers champion in the practice, and in all referrals I do, I highlight if a person is a carer. So if they have an operation or they need something to be done, that it's recognised the importance of getting them back into wherever they are caring with the utmost efficiency. I've got Councillor Walters.
Short and sweet. My question has already been answered, so I'm not going to waste your time. Thank you.
One item, I did forget.
Sorry, Councillor Wilmot, we'll come back to you.
Oh, okay.
Hold that thought. Councillor Tideswell.
Thank you, Chair. A couple of things I would like to pick up. I am struggling to actually follow this because I'm having problems hearing everybody. If you put the laptop up in front of your mic, sorry, the mic won't pick it up. If you don't speak directly to the mic does struggle to actually pick your voices up. But we'll get back to the circumstances now. We will mention about carers. Apparently, I was reading through and they were saying a lot of the carers aren't actually claiming this, that, and the other, which actually I think is a self-naivety to accept why they're not claiming. Everything is means tested, as we all know. And if a carer is just under the threshold, if they actually claim for caring, they get taxed. So it is a bit self-defeating. This, we must admit, is part of the reason, but for some reason it's not known. But it is a well-known fact. I know quite a few carers who say, oh, no, I'm not claiming for looking after so-and-so because it takes me over the threshold, which means they're going to actually be worse off. So I think that we need to find a way of readdressing that somehow. But that will have to be from central government.
Thank you, Councillor Tideswell. I'm going to go to Councillor Crosby.
Thank you, Chair. I think it's brilliant that, but I've got a couple of things in Newark that aren't quite working right. So I don't know if it might be better. Well, one, I'll tell you one of them. The carer hub has no regular worker, and the members are feeding back their frustrations about not having a support worker in Newark, and the facilitation is shared among 3 staff. No consistency, no rapport. For many, it's their only trip out socially, and it's once a month. And it's not quite working right. Maybe I need to I could even give you this because like there's 3 things on it, and it's all a bit negative. So I don't want to bring it down because it's just the little things that are happening in Newark. So shall I do that, or shall I read them out?
Well, we can take it and Catherine do a reply. Do a written
Sorry,
reply.
I wasn't sure which one.
Yes, Anna. Yeah, we're quite happy to take that off you, Councillor Crosby. And
brilliant. That would be really good, and then you can look into it in more depth, can't you?
Thank you, Councillor Crosby. I'm going to come back very briefly, Councillor Wilmot.
We should be ensuring that all young carers are identified. Yeah, I'm just saying we've got to ensure that all young carers are identified. That there are a lot of youngsters, really young, that doing bits and bobs for the parents, disabled parents, and so forth. So we need to find out who they are, and the only way you can do that is by contacting the schools and asking them, through the school, who is helping out in the home, because it's essential, because we want a young person that's actually doing something for the family. It can be a strenuous situation, and they can be suddenly having stress, and we don't want that to happen. So they need help to provide, whatever type of whatever they're delivering to their parents. They need help in making sure they're doing it the best possible way, because there are some that have never been identified, because when they get home they start doing chores for the disabled family.
Absolutely, and I think we'll come back to this again and again and again, and a lot of it is covered within recommendations number 1 to 12. I'm going to give the last word, because we must move on to Anna. Do you have anything in what you've heard to pick up on?
Just thank you all of you, and thank you, Councillor Crosby. I'm more than happy to take that on board. I do know that we've had some recruitment issues, I think it's safe to say, with the new service, so hopefully that will be addressed in the very near future. Yeah.
Thank you. I formally move to recommendations of recommendations 1 to 12. Can I have a seconder? All those in favour? Okay. Thank you very much, Hannah. I'm going to move on now to Joanna Cooper to bring us to the approved, refreshed Joint Strategic Needs Assessment. Approved, refreshed. What more can we do with it, Joanna?
Thank you, Chen. Thank you for having me back. So for those of you I've not met, I'm Joanna Cooper. I'm Assistant Director of Strategy at the ICB, but I hold the pen on our System Integrated Care Strategy and our NHS Joint Forward Plan. And we've had a few conversations over the last few months. I'm going to take the paper as read that's in your pack, but there's a few things I just wanted to pull out. So first of all, the Integrated Care Strategy, which we had some really helpful conversations on. And had some helpful feedback on shaping the priorities. The Integrated Care Partnership actually met on the 22nd of March, and they've approved the strategy for the coming year. That's going to be published very, very soon. Councillor Doddy assures me he's almost finished with that, and we'll be able to get a copy of that to you shortly. And then the main part of this paper really is about the NHS Joint Forward Plan. So that's the delivery plan for our NHS partners of how they're going to deliver the strategy, and it sits alongside the joint health and wellbeing strategies for the city and for the county, and it builds on a lot of the good work that we've got on strategies we have, like the carers strategy that Anna's just presented. We've pulled through carers into the integrated care strategy and JFP to make sure we're weaving that through everything that we do. We've had some really helpful discussions here too about joint forward plans, so thank you again for your feedback. We've had 75 either written responses or conversations in forums like this, so there's been an awful lot of feedback on this one document, but it is so important for us to collectively work on. We had a survey as well with our citizens and had 118 responses to that, so really positive engagement from local people in what could be something that's quite dry and bureaucratic. So we are really trying our best to bring this plan to life. The feedback, in summary, it's been really positive on how the Joint Forward Plan is reflecting the aims, ambitions, the principles that are set out in the Integrated Care Strategy. So it's been a really helpful exercise to do that refresh. I think since the last time we had a conversation, since last Health and Wellbeing Board, we've had updated guidance from NHS England. Just as we were about to hit the button on publishing the document, we had a bit of a stay, and we've got an extension until June. So we've quickly come up with a plan within the ICB, and we're looking to take the final version of the Joint Forward Plan to the Integrated Care Board meeting on the 9th of May. So we do have a short period of time to make sure that our plan aligns with NHS operational plans, because that's also had a delay in when the guidance was published and the work's been taking place. In the report itself, in paragraph 12, there's a statement of support from Health and Wellbeing Board members. It'd be really helpful to get your support for that today. And then in terms of the next steps, we will continue to be working with VIV. We really want to make sure we bring both the strategy and the Joint Forward Plan to life, embed the principles and the aims and ambitions into everything that we're doing. So we've got pieces of work on the Joint Forward Plan specifically to strengthen the governance with a Joint Forward Plan delivery group, which will sit alongside and be complementary with the Joint Health and Wellbeing Strategy delivery group that you have in the county and a similar body that operates in the city. We'll be looking as well at developing the reporting arrangements, how we report on outcomes for the population, so that we can really demonstrate that these documents are having an impact on local people. And we'll make sure all of those arrangements are complementary with what we're developing for the joint health and wellbeing strategies, and so that you're kept in the loop with that progress, as well as the Integrated Care Partnership and the ICB board. That's everything from me today, and as I said, your support for that statement in paragraph 12 would be really appreciated. Thank you.
Thanks very much, Joanna. Just to remind people that the vision of the strategies to improve the outcomes in the population health, tackle health inequalities, improve productivity and support social and economic development. We as a Health and Wellbeing Board have our own strategy and have had since 2012. The city have a similar strategy. Those two strategies were merged into an ICS strategy, which has been subsequently adopted and overseen by the Integrated Care Partnership, and this is the contribution of the Integrated Care Board towards making sure that they are working towards the delivery of that overall ICS strategy, and therefore we're all working towards the primary goal. It is easy for an ICS or an NHS body to spend everything on immediate care, on immediate demand related things, but we've seen that a lot of our things like this afternoon will be on the building blocks of health, and they don't fall into emergency care or into any department or wards. They fall into place-based partnerships in the communities in which we live, and therefore, as Cathy McLean would say, it's our job to be the guiding mind behind the spend of the ICS, and particularly the ICB. So this really is to note the progress on this refresh before it goes back to the ICB, and to formally recommend the recommendations in this phase. So has anybody got anything that they would like to particularly ask Joanna about? Yes, so Councillor, I can't even read your name, but Angie Jackson. Angie Jackson. Jackson. Councillor Jackson.
Yes, thank you. Mansfield District Council. I fully support the principles. I suppose my question, and I might have missed it, is about time frame. So at what point will we be able to say that this plan is working, that we've got that we've got improved navigation and flow through emergency departments, for example? Is there an actual time frame around this at this stage?
Thank you. Joanna?
Sorry, I pressed the wrong button. Thank you, Councillor Jackson. So the reporting arrangements for the Joint Forward Plan, our intention is to take twice annual reports to the Integrated Care Board that goes through all of the detail in the Joint Forward Plan. We'll be looking at those high-level outcomes and some of the metrics that we can monitor underneath that to show the impact on local people in as much detail as we can, and doing that reporting twice a year.
Thank you. Councillor Caroline Ellis. Forget it. Okay. Helen Smith.
Just a point of clarity, really. In terms of supporting the statement, if we haven't seen the refreshed version, I'm not sure how comfortable colleagues are to sign up to that statement right now, but note that it will follow. So do we provisionally accept it subject to it's just something I don't quite feel comfortable about, agreeing to that statement without having seen that it has taken account of this group's input.
This is the proposed final version, Joanna. Yes, it has come before us on a number of occasions, and I suspect the very fact that it has come back and back and back shows the degree of scrutiny in which it's been under to begin with, that it wasn't just a strategy that was thrust upon us, but one in which we've moulded to our own vision. Would that be fair, Joanna?
Yes, absolutely, but happy to share that version with you. I'm preparing a note that will go out ahead of the ICB board that has a copy of the Joint Forward Plan, so that there's a small window of time to make any final comments and amendments before the board considers, and then there'll be at that time afterwards to make any amendments if we need to.
Fantastic, Joanna. I'm going to propose that we note the refreshed version of the NHS Joint Forward Plan Can I have a seconder for that? All those in favour? Excellent. So we're going to move in the next 5 minutes to the work programme. There's some exciting workshops coming up as we move forward. This afternoon is the building blocks of health, following on from the joint strategic needs assessments that we did at our last meeting. The next meeting that I've got here is the 22nd of May, and that one has the suicide prevention workshop. We will probably have an additional meeting as a workshop somewhere around May to reflect the external evaluation of the Health and Wellbeing Board in its activities, and with suggestions going forward with regards to refinements, etc. People were asking, if this section is too short, we don't get enough time to discuss the JSNAs. If the workshop is too short, we don't get enough time to actually understand what we're meant to do with the information that's provided, and it'll be a wonderful opportunity for people to contribute to the Health and Wellbeing Board in the model in which we are looking forward to presenting. Can I just ask, Lizzie, have you got anything to add to the timescale for that?
Nothing particularly to add, Councillor Doddy, other than it'll probably be June, more like June time, that we have that workshop, but there'll be a intention to bring a short update on the review at the May meeting to support that, to introduce that workshop.
Fantastic, and many of you will have contributed to it and will no doubt be quite excited at the outcome of those contributions. So I'm going to thank you all for the first part of this afternoon. You have 5 minutes to make it to the assembly room for coffee, tea, biscuits, and the workshop on the building blocks of health. I'll see you in 5 minutes. Thank you.